Hello, nursing students. Welcome to our channel, Nursing Exam Preparation. In this video, we'll guide you through the top 250 gastrointestinal nursing true or false questions and answers, each accompanied by detailed explanations to ensure you fully understand the concepts. This comprehensive resource is designed to support your nursing exam preparation, helping you excel in gastrointestinal nursing and approach related questions with confidence. Feel free to watch the video as many times as needed. Repetition is key to mastering the material and reinforcing your knowledge. Whether you're just beginning your studies or preparing for a final review, these questions are crafted to test your knowledge, challenge your critical thinking, and strengthen essential gastrointestinal nursing principles. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more valuable content to support your success. Hit the bell icon to stay updated with all our latest videos filled with tips, strategies, and exam-focused resources. Once you've completed the video, be sure to comment below with your score. We'd love to hear how you did. Let's dive into the world of gastrointestinal nursing, sharpen your skills, and get ready to ace your exams with confidence. 1. The nurse should assess for signs of dehydration in a child with severe diarrhea. True or false? Answer: true. Rationale: dehydration is a common and serious complication of diarrhea, especially in children, due to loss of fluids and electrolytes. Early detection and treatment are essential to prevent severe dehydration and its complications. 2. It is safe to administer magnesium-based antacids to a patient with renal failure. True or false? Answer: false. Rationale: magnesium-based antacids should be avoided in patients with renal failure because their kidneys cannot effectively eliminate magnesium, leading to toxicity. Alternative antacids, such as calcium-based options, may be used instead. 3. Lactose intolerance is commonly diagnosed with a blood test for serum lactose levels. True or false? Answer: false. Rationale: lactose intolerance is typically diagnosed through clinical symptoms and lactose breath tests, rather than blood tests. Serum lactose levels do not provide definitive information about lactose intolerance. 4. A patient with ulcerative colitis should follow a low-residue diet to reduce symptoms of diarrhea. True or false? Answer: true. Rationale: a low-residue diet helps to reduce the amount of undigested food moving through the intestines, which can reduce the frequency of diarrhea and the risk of irritation in patients with ulcerative colitis. 5. The nurse should prioritize pain management in a child with appendicitis before performing an abdominal examination. True or false? Answer: false. Rationale: it is important to perform an abdominal examination before administering pain relief in suspected appendicitis, as pain relief can alter the clinical presentation, which may affect diagnosis. 6. Prolonged vomiting in a child with gastroenteritis can lead to metabolic acidosis. True or false? Answer: false. Rationale: vomiting typically leads to metabolic alkalosis due to the loss of gastric hydrochloric acid. However, diarrhea in gastroenteritis can lead to metabolic acidosis, as it results in the loss of bicarbonate. 7. Total parenteral nutrition, TPN, is used for patients who are unable to absorb nutrients through their gastrointestinal tract. True or false? Answer: true. Rationale: total parenteral nutrition, TPN, provides nutrition intravenously and is used for patients who are unable to absorb nutrients through their gastrointestinal tract, such as those with severe malabsorption or gastrointestinal surgery. 8. An ileostomy involves the removal of the colon, with the creation of an opening in the ileum for waste elimination. True or false? Answer: true. Rationale: an ileostomy is a surgical procedure where the ileum is diverted to the abdominal surface to allow waste elimination. It is commonly performed after the removal of the colon. 9. It is safe for a patient with cirrhosis to consume alcohol in moderation. True or false? Answer: false. Rationale: patients with cirrhosis should avoid alcohol completely, as it can further damage the liver and exacerbate the disease, potentially leading to liver failure. 10. A high-fiber diet is recommended for patients with diverticulitis during an acute flare-up. True or false? Answer: false. Rationale: During an acute flare-up of diverticulitis, a low-fiber or clear liquid diet is recommended to reduce irritation in the colon. High-fiber foods may increase the risk of perforation or worsening of symptoms. 11. Crohn's disease and ulcerative colitis are both types of inflammatory bowel disease, IBD. True or false? Answer: true. Rationale: both Crohn's disease and ulcerative colitis are chronic inflammatory conditions that fall under the umbrella termed inflammatory bowel disease, IBD. They share common symptoms such as diarrhea and abdominal pain, but they affect different parts of the gastrointestinal tract. 12. The nurse should advise a patient with gastroesophageal reflux disease, GERD, to lie down immediately after eating to relieve symptoms. True or false? Answer: false. Rationale: patients with GERD should avoid lying down immediately after eating as it can exacerbate reflux symptoms. Elevating the head of the bed and remaining upright for at least 30 minutes after meals can help prevent symptoms. 13. A patient with liver cirrhosis should be monitored for signs of hypoglycemia due to impaired glycogen storage. True or false? Answer: true. Rationale: liver cirrhosis impairs the liver's ability to store and release glucose, leading to an increased risk of hypoglycemia, especially in patients who are not eating or are undergoing fasting. 14. It is safe to administer a bulk-forming laxative to a patient with acute abdominal pain without evaluating the cause. True or false? Answer: false. Rationale: bulk-forming laxatives should not be given to a patient with acute abdominal pain until the cause is determined, as they could exacerbate conditions like bowel obstruction or perforation. 15. A patient who is post-op from a gastrectomy should be encouraged to consume high-sugar foods to promote healing. True or false? Answer: false. Rationale: after a gastrectomy, patients should avoid high-sugar foods as they can exacerbate dumping syndrome, a condition where undigested food moves too quickly through the stomach into the small intestine. 16. Patients with chronic pancreatitis are at increased risk of developing diabetes mellitus. True or false? Answer: true. Rationale: chronic pancreatitis can lead to damage of the pancreas, impairing its ability to secrete insulin, which increases the risk of developing diabetes mellitus. 17. The nurse should avoid providing high-protein foods to patients with cirrhosis due to the risk of hepatic encephalopathy. True or false? Answer: false. Rationale: while patients with cirrhosis may need to limit protein intake if hepatic encephalopathy is present, protein is still necessary for tissue repair and overall nutrition. The goal is to monitor and adjust protein intake based on individual patient needs and liver function. 18. Total parenteral nutrition, TPN, should be used only in patients who are expected to need nutritional support for a short period. True or false? Answer: false. Rationale: TPN is used in patients who require long-term nutritional support when enteral feeding is not an option. It can be used for both short and long-term needs, depending on the patient's condition. 19. A patient with peptic ulcer disease should avoid eating spicy foods to reduce irritation in the stomach. True or false? Answer: true. Rationale: spicy foods can irritate the gastric mucosa and exacerbate symptoms of peptic ulcer disease. A bland, low-acid diet is typically recommended to promote healing. 20. A patient with irritable bowel syndrome, IBS, should be encouraged to follow a high-fiber diet. True or false? Answer: true. Rationale: a high-fiber diet can help regulate bowel movements and reduce symptoms of IBS, especially in patients who experience constipation. However, fiber intake should be gradually increased to avoid bloating and discomfort. 21. A patient with celiac disease should avoid foods containing gluten, including wheat, barley, and rye. True or false? Answer: true. Rationale: celiac disease is an autoimmune disorder in which gluten causes damage to the small intestine. Patients must strictly avoid gluten-containing foods such as wheat, barley, and rye to prevent symptoms and intestinal damage. 22. An ileostomy involves the diversion of the large intestine to an opening in the abdominal wall. True or false? Answer: false. Rationale: an ileostomy involves the diversion of the small intestine, specifically the ileum, to an opening in the abdominal wall. A colostomy, not an ileostomy, involves the large intestine. 23. A patient with Crohn's disease can safely take antidiarrheal medications to reduce symptoms. True or false? Answer: false. Rationale: antidiarrheal medications should be used cautiously in patients with Crohn's disease, as they can lead to bowel obstruction or worsen symptoms by slowing gut motility when the bowel is already inflamed. 24. A patient with pancreatitis should be placed on a low-fat diet to reduce the workload of the pancreas. True or false? Answer: true. Rationale: a low-fat diet is recommended for patients with pancreatitis to reduce the secretion of pancreatic enzymes and decrease the workload on the pancreas, allowing for healing. 25. Proton pump inhibitors, PPIs, are contraindicated for patients with a history of peptic ulcer disease. True or false? Answer: false. Rationale: PPIs are commonly used to treat peptic ulcer disease by reducing stomach acid production, promoting ulcer healing, and preventing recurrence. They are not contraindicated but should be used with caution in long-term treatment. 26. The nurse should avoid administering magnesium-based antacids to patients with renal insufficiency. True or false? Answer: true. Rationale: magnesium-based antacids are contraindicated in patients with renal insufficiency because they can accumulate in the body and lead to magnesium toxicity. 27. A patient with diverticulosis should be encouraged to consume a low-fiber diet to minimize symptoms. True or false? Answer: false. Rationale: a high-fiber diet is recommended for patients with diverticulosis to prevent constipation and decrease the risk of diverticulitis, which can occur if fecal matter gets trapped in diverticula. 28. Hepatitis B is transmitted primarily through contaminated water and food. True or false? Answer: false. Rationale: hepatitis B is primarily transmitted through blood, sexual contact, and from mother to child during childbirth, not through contaminated food and water. 29. A patient with a colostomy should be instructed to avoid foods that can cause excessive gas or odor. True or false? Answer: true. Rationale: foods that produce excessive gas or odor, such as beans and cabbage, can cause discomfort and embarrassment for patients with a colostomy. Patients should be educated on dietary management to minimize these issues. 30. An esophageal stricture in a patient with GERD can cause difficulty swallowing, dysphagia. True or false? Answer: true. Rationale: an esophageal stricture, a common complication of GERD, occurs due to scarring and narrowing of the esophagus, leading to difficulty swallowing, dysphagia, and other symptoms like chest pain. 31. The nurse should monitor for signs of hypokalemia in patients receiving loop diuretics with gastrointestinal disorders. True or false? Answer: true. Rationale: loop diuretics can cause potassium loss, which may lead to hypokalemia. Monitoring potassium levels is essential for patients on diuretics, especially those with gastrointestinal issues like vomiting or diarrhea. 32. A patient with acute pancreatitis should be encouraged to consume a high-fat diet to promote healing. True or false? Answer: false. Rationale: a high-fat diet should be avoided in patients with pancreatitis because it can exacerbate inflammation and increase the risk of complications. A low-fat diet is recommended to reduce the workload on the pancreas. 33. A patient with Crohn's disease may experience skip lesions, which are patches of inflammation scattered along the gastrointestinal tract. True or false? Answer: true. Rationale: Crohn's disease is characterized by skip lesions, where inflammation occurs in patches, often affecting any part of the gastrointestinal tract from the mouth to the anus. 34. Patients with a colostomy should avoid foods that cause excessive bowel movement odor, like garlic and onions. True or false? Answer: true. Rationale: foods like garlic and onions can contribute to excessive odor and gas production in the colostomy pouch. Patients should be educated on managing these dietary factors. 35. Lactose intolerance occurs when the body lacks the enzyme lactase needed to break down lactose in dairy products. True or false? Answer: true. Rationale: Lactose intolerance is due to the insufficient production of lactase, the enzyme responsible for digesting lactose, leading to symptoms like bloating, diarrhea, and abdominal pain when consuming dairy products. 36. The primary goal of treatment for diverticulitis is to reduce inflammation and prevent complications, such as perforation. True or false? Answer: true. Rationale: the goal of treatment for diverticulitis includes reducing inflammation through antibiotics and rest, and preventing complications such as perforation, abscess, and fistula formation. 37. Patients with liver cirrhosis are at an increased risk for developing portal hypertension. True or false? Answer: true. Rationale: cirrhosis causes scarring of the liver, which obstructs blood flow and increases pressure in the portal vein, leading to portal hypertension. 38. The nurse should encourage fluid intake for patients experiencing diarrhea to prevent dehydration. True or false? Answer: true. Rationale: diarrhea leads to the loss of fluids and electrolytes, so increasing fluid intake is crucial to prevent dehydration and maintain electrolyte balance. 39. In patients with gastroesophageal reflux disease, GERD, the nurse should recommend elevating the head of the bed to reduce reflux. True or false? Answer: true. Rationale: elevating the head of the bed helps prevent gastric acid from flowing back into the esophagus, reducing the symptoms of GERD. 40. Prolonged use of proton pump inhibitors, PPIs, can increase the risk of Clostridium difficile infection. True or false? Answer: true. Rationale: PPIs reduce stomach acid, which can alter the normal gut microbiome, increasing the risk of infections like Clostridium difficile. 41. Patients who have undergone bariatric surgery should be monitored for nutritional deficiencies due to reduced nutrient absorption. True or false? Answer: true. Rationale: bariatric surgery, especially gastric bypass, reduces the stomach's ability to absorb nutrients, increasing the risk of deficiencies in vitamins and minerals, such as vitamin B12 and iron. 42. A low-fiber diet is recommended for patients with irritable bowel syndrome, IBS, to avoid irritation. True or false? Answer: false. Rationale: a high-fiber diet is recommended for patients with IBS, particularly for those with constipation. Fiber helps regulate bowel movements and can reduce IBS symptoms. 43. Gallstones are often asymptomatic and may not require treatment unless complications occur. True or false? Answer: true. Rationale: many individuals with gallstones are asymptomatic and may not require treatment unless they develop complications such as biliary colic or cholecystitis. 44. A nurse should encourage the use of over-the-counter antacids as the first line of treatment for severe gastric ulcers. True or false? Answer: false. Rationale: antacids can provide temporary relief, but severe gastric ulcers require more aggressive treatment with proton pump inhibitors, PPIs, or H2 blockers, which help reduce stomach acid and promote healing. 45. Patients with cirrhosis may experience ascites, which is the accumulation of fluid in the abdominal cavity. True or false? Answer: true. Rationale: ascites is a common complication of cirrhosis caused by portal hypertension and decreased liver function, leading to fluid accumulation in the abdomen. 46. The nurse should avoid administering aspirin to patients with peptic ulcer disease due to the risk of bleeding. True or false? Answer: true. Rationale: aspirin is an NSAID that can irritate the gastric mucosa and increase the risk of bleeding and ulcer formation, making it contraindicated for patients with peptic ulcer disease. 47. A patient with acute cholecystitis may require surgical intervention to remove the gallbladder. True or false? Answer: true. Rationale: cholecystectomy, the surgical removal of the gallbladder, is often required for patients with acute cholecystitis to prevent further complications like perforation or infection. 48. Proton pump inhibitors, PPIs, are the most effective treatment for managing the symptoms of gastroesophageal reflux disease, GERD. True or false? Answer: true. Rationale: PPIs are the most effective medications for reducing gastric acid production, which helps manage GERD symptoms and promote healing of the esophagus. 49. The nurse should encourage the use of soft, bland foods for patients experiencing nausea and vomiting. True or false? Answer: true. Rationale: soft, bland foods like crackers or toast are gentle on the stomach and can help reduce nausea and vomiting by avoiding irritation. 50. For patients with ulcerative colitis, the nurse should monitor for signs of dehydration due to diarrhea. True or false? Answer: true. Rationale: ulcerative colitis can cause frequent diarrhea, leading to dehydration. It is important to monitor fluid and electrolyte status in these patients to prevent complications. 51. A patient with gastrointestinal bleeding should be placed on a high-fiber diet to promote healing. True or false? Answer: false. Rationale: a high-fiber diet is not recommended for patients with gastrointestinal bleeding, as it may aggravate the bleeding or cause further irritation. A low-fiber, soft diet may be preferred. 52. Hepatitis C is primarily transmitted through sexual contact. True or false? Answer: false. Rationale: hepatitis C is most commonly transmitted through blood-to-blood contact, often through sharing needles or receiving contaminated blood products. It is not primarily transmitted through sexual contact. 53. A high-protein diet is recommended for patients with cirrhosis to support liver regeneration. True or false? Answer: false. Rationale: while protein is necessary, too much protein can exacerbate hepatic encephalopathy in patients with cirrhosis. Protein intake should be moderate and adjusted according to the patient's condition. 54. Patients with peptic ulcer disease should avoid drinking caffeinated beverages to prevent increased gastric acid secretion. True or false? Answer: true. Rationale: caffeine stimulates gastric acid secretion and can exacerbate the symptoms of peptic ulcer disease. It is advisable for patients with ulcers to avoid caffeinated drinks. 55. An ileostomy produces liquid stool due to the diversion of the ileum to the abdominal wall. True or false? Answer: true. Rationale: an ileostomy involves diverting the ileum to an opening in the abdominal wall, resulting in the output of liquid stool as the colon, which absorbs water, is bypassed. 56. The nurse should monitor for signs of peritonitis in a patient with gastrointestinal perforation, such as severe abdominal pain and rigidity. True or false? Answer: true. Rationale: peritonitis is a life-threatening complication of gastrointestinal perforation, characterized by symptoms such as severe abdominal pain, rigidity, and fever. Early identification is critical for effective treatment. 57. A patient with chronic hepatitis B should be educated on the need for regular monitoring of liver function tests. True or false? Answer: true. Rationale: chronic hepatitis B can lead to liver damage, so regular monitoring of liver function tests is essential to assess the progression of the disease and determine appropriate interventions. 58. The nurse should educate a patient with gastroesophageal reflux disease, GERD, to avoid eating large meals late at night. True or false? Answer: true. Rationale: eating large meals late at night can increase the risk of reflux by promoting gastric acid production and lowering esophageal sphincter pressure. Smaller, more frequent meals are recommended. 59. A diet high in saturated fats is beneficial for patients with gallbladder disease. True or false? Answer: false. Rationale: a high saturated fat diet can worsen gallbladder disease and promote the formation of gallstones. A low-fat diet is recommended to prevent gallstone formation and alleviate symptoms. 60. Diarrhea in elderly patients should always be treated with antidiarrheal medications to prevent dehydration. True or false? Answer: false. Rationale: while dehydration is a concern, antidiarrheal medications should not be used indiscriminately in elderly patients, as they may mask the underlying cause of diarrhea or lead to complications such as ileus. 61. Patients with acute gastrointestinal bleeding should be encouraged to consume solid foods immediately after stabilization. True or false? Answer: false. Rationale: after stabilization, patients with acute gastrointestinal bleeding should begin with clear liquids or soft foods, progressing slowly to solid foods as tolerated to prevent further irritation. 62. A low-sodium diet is important for patients with cirrhosis to prevent fluid retention and ascites. True or false? Answer: true. Rationale: a low-sodium diet helps to manage fluid retention and prevent the worsening of ascites, a common complication in patients with cirrhosis. 63. Patients with Crohn's disease are more likely to develop colorectal cancer compared to individuals without the disease. True or false? Answer: true. Rationale: Crohn's disease, particularly when it involves the colon, increases the risk of colorectal cancer due to chronic inflammation that may lead to cellular changes over time. 63. Patients with Crohn's disease are more likely to develop colorectal cancer compared to individuals without the disease. True or false? Answer: true. Rationale: Crohn's disease, particularly when it involves the colon, increases the risk of colorectal cancer due to chronic inflammation that may lead to cellular changes over time. 65. An enema may be necessary for patients with severe constipation, especially when there is an impaction. True or false? Answer: true. Rationale: an enema is often used to relieve constipation, particularly in cases of fecal impaction, to facilitate bowel movement and prevent complications. 66. Chronic use of corticosteroids can cause gastrointestinal side effects such as peptic ulcers and gastrointestinal bleeding. True or false? Answer: true. Rationale: chronic use of corticosteroids can increase gastric acid secretion, which may lead to the formation of peptic ulcers and increase the risk of gastrointestinal bleeding. 67. Hepatitis A is transmitted through blood transfusions and contact with infected blood. True or false? Answer: false. Rationale: hepatitis A is primarily transmitted through the fecal-oral route, often through contaminated food or water, rather than through blood transfusions. 68. The primary treatment goal for patients with irritable bowel syndrome, IBS, is to relieve symptoms through dietary and lifestyle changes. True or false? Answer: true. Rationale: IBS treatment primarily focuses on symptom management, which includes dietary changes, e.g., increased fiber intake, and stress management. Medications may be used to address specific symptoms. 69. Gastrostomy tubes, G-tubes, should be checked for placement before administering any oral medications or feeding. True or false? Answer: true. Rationale: G-tubes should always be checked for proper placement before administering medications or feeding to prevent aspiration and ensure the correct delivery route. 70. Constipation can be managed by increasing fluid intake, physical activity, and dietary fiber. True or false? Answer: true. Rationale: increasing fluid intake, physical activity, and dietary fiber are key components in the management of constipation, as they promote regular bowel movements and prevent further complications. 71. The nurse should instruct patients with celiac disease to avoid gluten-containing foods such as wheat, barley, and rye. True or false? Answer: true. Rationale: patients with celiac disease must avoid gluten, a protein found in wheat, barley, and rye, to prevent triggering the autoimmune response that damages the small intestine. 72. Diarrhea caused by Clostridium difficile, C. difficile, is commonly treated with oral metronidazole or oral vancomycin. True or false? Answer: true. Rationale: oral metronidazole or vancomycin is used to treat C. difficile infections, as these antibiotics target the bacteria responsible for the infection. 73. The nurse should encourage high-protein foods for patients with acute pancreatitis to support healing. True or false? Answer: false. Rationale: during acute pancreatitis, patients should avoid high-protein foods as they can stimulate pancreatic enzyme secretion, which can worsen inflammation. A low-fat, low-protein diet is recommended during this phase. 74. The administration of sucralfate is beneficial for patients with peptic ulcers as it forms a protective barrier over the ulcer site. True or false? Answer: true. Rationale: sucralfate helps form a protective coating over peptic ulcers, preventing further irritation from gastric acid and promoting healing. 75. A high-fiber diet is recommended for patients recovering from abdominal surgery to promote bowel regularity. True or false? Answer: true. Rationale: a high-fiber diet is important in postoperative recovery to promote bowel movement and prevent constipation. However, it should be gradually introduced to avoid overwhelming the digestive system. 76. Chronic alcohol use can lead to fatty liver disease, which can progress to cirrhosis over time. True or false? Answer: true. Rationale: chronic alcohol use is a major cause of fatty liver disease, which can progress to alcoholic cirrhosis, characterized by liver scarring, decreased liver function, and complications such as portal hypertension. 77. Hepatitis B infection can be spread through casual contact, such as hugging or shaking hands. True or false? Answer: false. Rationale: hepatitis B is transmitted through blood, semen, or other body fluids, not through casual contact such as hugging or shaking hands. 78. Colonoscopy is the preferred screening method for colorectal cancer in individuals over the age of 50. True or false? Answer: true. Rationale: colonoscopy is the gold standard for colorectal cancer screening, allowing for early detection and removal of polyps in individuals over the age of 50 or with a family history of the disease. 79. Lactulose is commonly prescribed for patients with cirrhosis to treat hepatic encephalopathy by reducing ammonia levels. True or false? Answer: true. Rationale: lactulose helps treat hepatic encephalopathy by reducing blood ammonia levels, which can accumulate due to liver dysfunction, affecting brain function. 80. Nausea and vomiting associated with chemotherapy are best treated with antacids to neutralize stomach acid. True or false? Answer: false. Rationale: nausea and vomiting related to chemotherapy are better managed with antiemetic medications rather than antacids, as antiemetics target the underlying causes of nausea, such as chemotherapy-induced nausea. 81. A patient with chronic constipation should avoid excessive use of laxatives, as they can lead to dependency. True or false? Answer: true. Rationale: overuse of laxatives can lead to bowel dependency, making it difficult for the patient to have regular bowel movements without them. Non-pharmacological measures like diet changes are preferred. 82. A patient with liver cirrhosis should limit protein intake to prevent the development of hepatic encephalopathy. True or false? Answer: true. Rationale: limiting protein intake helps prevent the accumulation of ammonia, which can cause hepatic encephalopathy. The amount of protein should be carefully balanced. 83. A patient with gastric reflux should avoid tight-fitting clothing to prevent increasing abdominal pressure. True or false? Answer: true. Rationale: tight-fitting clothing can increase intra-abdominal pressure, leading to a higher likelihood of gastric reflux. Loose, comfortable clothing can help reduce reflux symptoms. 84. Patients with diverticulosis should avoid nuts, seeds, and popcorn, as these foods may lodge in diverticula and cause inflammation. True or false? Answer: true. Rationale: nuts, seeds, and popcorn can become lodged in diverticula, potentially causing inflammation or infection, so they are often avoided in patients with diverticulosis. 85. Gastroesophageal reflux disease, GERD, is a risk factor for the development of Barrett's esophagus. True or false? Answer: true. Rationale: GERD can lead to chronic irritation of the esophagus, which may result in the development of Barrett's esophagus, a condition where normal esophageal cells are replaced by abnormal cells, increasing the risk of esophageal cancer. 86. Pancreatitis can be caused by gallstones, which block the bile duct and interfere with pancreatic function. True or false? Answer: true. Rationale: gallstones can block the bile duct, which can lead to pancreatitis by preventing the normal flow of bile and pancreatic enzymes. 87. A nurse should educate patients with gastric ulcers to avoid alcohol, as it can irritate the stomach lining and delay healing. True or false? Answer: true. Rationale: alcohol can irritate the stomach lining, exacerbate ulcer symptoms, and delay the healing process, so it is recommended that patients with gastric ulcers avoid alcohol. 88. Patients with a history of peptic ulcers should be instructed to eat large meals to reduce the amount of acid in the stomach. True or false? Answer: false. Rationale: Large meals can increase gastric acid production and worsen ulcer symptoms. Smaller, more frequent meals are recommended to reduce the risk of irritation. 89. High-fiber foods like fruits and vegetables can help manage both constipation and diarrhea by regulating bowel movements. True or false? Answer: true. Rationale: high-fiber foods help to normalize bowel movements by absorbing excess water in cases of diarrhea and adding bulk in cases of constipation. 90. Gastric cancer risk is higher in patients who are infected with Helicobacter pylori. True or false? Answer: true. Rationale: infection with Helicobacter pylori is a known risk factor for the development of gastric cancer, as it can cause chronic inflammation of the stomach lining, leading to cancerous changes. 91. Patients with liver cirrhosis should avoid high potassium foods if they develop hyperkalemia. True or false? Answer: true. Rationale: hyperkalemia can occur in cirrhosis due to impaired renal function, and avoiding high potassium foods helps prevent further elevation of potassium levels, which can lead to cardiac arrhythmias. 92. A high-fat diet is recommended for patients recovering from gallbladder surgery to aid in the digestion of fats. True or false? Answer: false. Rationale: after gallbladder surgery, patients are often advised to follow a low-fat diet to reduce the strain on the digestive system, as the gallbladder is no longer present to help emulsify fats. 93. A patient with ulcerative colitis is more likely to experience bloody diarrhea than a patient with Crohn's disease. True or false? Answer: true. Rationale: ulcerative colitis typically causes bloody diarrhea due to inflammation and ulceration of the mucosal lining of the colon, whereas Crohn's disease may involve other parts of the gastrointestinal tract and usually does not cause as much bloody diarrhea. 94. The nurse should monitor for signs of dehydration in patients with chronic diarrhea. True or false? Answer: true. Rationale: chronic diarrhea can lead to significant fluid and electrolyte loss, increasing the risk of dehydration, which must be closely monitored and managed. 95. A patient with GERD should be advised to lie down immediately after eating to facilitate digestion. True or false? Answer: false. Rationale: lying down after eating can worsen GERD symptoms by increasing intra-abdominal pressure and allowing gastric acid to reflux into the esophagus. Patients should wait at least 2 to 3 hours before lying down. 96. Antacids can neutralize stomach acid, providing relief from heartburn symptoms in patients with GERD. True or false? Answer: true. Rationale: antacids work by neutralizing stomach acid, offering relief from heartburn and reflux symptoms. However, they should be used in combination with other treatments for long-term management. 97. Gastrostomy tube feeding is indicated for patients who cannot swallow or safely consume food orally. True or false? Answer: true. Rationale: gastrostomy tube feeding is often used for patients who cannot eat or swallow safely due to conditions such as neurological disorders or head and neck cancers. 98. The nurse should encourage patients with a diagnosis of pancreatitis to consume small, frequent meals high in protein. True or false? Answer: true. Rationale: small, frequent meals that are low in fat and high in protein can help reduce the burden on the pancreas and support healing in patients with pancreatitis. 99. Colostomy irrigation can help regulate bowel movements in patients with a colostomy. True or false? Answer: true. Rationale: colostomy irrigation can promote bowel regularity and control output in some patients with a colostomy, particularly those with a descending or sigmoid colostomy. 100. Patients with peptic ulcers should avoid spicy foods, as they can irritate the stomach lining and worsen ulcer symptoms. True or false? Answer: true. Rationale: spicy foods can irritate the gastric mucosa and worsen peptic ulcer symptoms, so they are often avoided in patients with ulcers. 101. Lactose intolerance is caused by a deficiency in the enzyme lactase, which is needed to digest lactose in dairy products. True or false? Answer: true. Rationale: lactose intolerance occurs due to a lack of lactase, the enzyme responsible for breaking down lactose in dairy products. This leads to symptoms such as bloating, diarrhea, and gas. 102. The nurse should avoid administering proton pump inhibitors, PPIs, with meals, as this can reduce their effectiveness. True or false? Answer: false. Rationale: PPIs are most effective when taken before meals, as they inhibit gastric acid production before food is ingested, helping to manage GERD and peptic ulcers. 103. Pancreatic cancer is often diagnosed at an early stage due to the clear presence of symptoms such as jaundice and abdominal pain. True or false? Answer: false. Rationale: pancreatic cancer is often diagnosed at a later stage due to its vague symptoms that may be mistaken for other conditions. By the time symptoms such as jaundice and abdominal pain occur, the cancer may have already spread. 104. The primary treatment for acute gastroenteritis is fluid replacement therapy to prevent dehydration. True or false? Answer: true. Rationale: fluid replacement is the cornerstone of treatment for acute gastroenteritis, as it helps prevent dehydration caused by vomiting and diarrhea. Electrolyte replacement may also be needed. 105. Paracentesis is a procedure used to remove fluid from the peritoneal cavity in patients with ascites. True or false? Answer: true. Rationale: paracentesis is a procedure performed to remove excess fluid from the peritoneal cavity in patients with ascites, often due to liver disease such as cirrhosis. 106. A high-fiber diet is beneficial for patients with diverticulosis to prevent the formation of diverticula. True or false? Answer: true. Rationale: a high-fiber diet helps to prevent the formation of diverticula in patients with diverticulosis by promoting regular bowel movements and reducing pressure within the colon. 107. A nasogastric (NG) tube can be used to decompress the stomach and remove gastric contents in patients with bowel obstruction. True or false? Answer: true. Rationale: an NG tube is commonly used to decompress the stomach, remove gastric contents, and relieve pressure in patients with bowel obstruction, providing symptom relief and preventing further complications. 108. Patients with Crohn's disease are more likely to experience periods of remission and flare-ups than those with ulcerative colitis. True or false? Answer: true. Rationale: Crohn's disease typically has periods of remission and flare-ups, whereas ulcerative colitis often involves continuous inflammation. This difference in disease behavior is an important factor in managing both conditions. 109. A patient with a history of peptic ulcers should avoid non-steroidal anti-inflammatory drugs, NSAIDs, due to the risk of exacerbating ulcer formation. True or false? Answer: true. Rationale: NSAIDs can irritate the gastric mucosa and increase the risk of peptic ulcer formation or bleeding, so they are generally avoided in patients with a history of peptic ulcers. 110. Antidiarrheal medications like loperamide are recommended for patients with severe, bloody diarrhea caused by infection. True or false? Answer: false. Rationale: antidiarrheal medications like loperamide should be avoided in cases of bloody diarrhea caused by bacterial infections, e.g., C. difficile, because they may worsen the infection by slowing bowel motility. 111. The nurse should educate patients with gallstones to consume low-fat meals to reduce the likelihood of a gallbladder attack. True or false? Answer: true. Rationale: low-fat meals can help reduce the risk of a gallbladder attack by decreasing the amount of bile released from the gallbladder, which may otherwise lead to the formation of gallstones or exacerbate existing ones. 112. A patient with a colostomy should avoid consuming gas-producing foods such as beans and cabbage to reduce the risk of discomfort. True or false? Answer: true. Rationale: gas-producing foods like beans and cabbage can increase flatulence and discomfort in patients with a colostomy. Avoiding these foods can help prevent excessive gas and odor. 113. Fiber supplements can be used to manage constipation in patients with opioid-induced constipation. True or false? Answer: false. Rationale: fiber supplements are not effective in managing opioid-induced constipation, as opioids slow bowel motility. Laxatives or stimulant medications may be needed to treat this condition. 114. The nurse should instruct patients with chronic liver disease to avoid alcohol, as it can worsen liver damage. True or false? Answer: true. Rationale: Alcohol can exacerbate liver damage, leading to further complications such as cirrhosis and hepatic encephalopathy. Avoidance is essential in managing chronic liver disease. 115. Vomiting in patients with gastrointestinal bleeding may present with a characteristic coffee ground appearance. True or false? Answer: true. Rationale: vomit with a coffee ground appearance occurs when blood in the stomach reacts with gastric acid, indicating upper gastrointestinal bleeding. 116. Lactulose can be used to treat hepatic encephalopathy by reducing ammonia absorption in the gut. True or false? Answer: true. Rationale: lactulose is effective in treating hepatic encephalopathy by reducing ammonia levels in the blood, as it traps ammonia in the colon and promotes its excretion. 117. The nurse should avoid administering opioid pain medications to patients with pancreatitis due to their potential to increase pancreatic secretions. True or false? Answer: true. Rationale: opioids can stimulate the pancreas to release digestive enzymes, which may worsen inflammation in pancreatitis. Non-opioid analgesics are preferred. 118. A colonoscopy should be performed every 10 years starting at age 50 for average-risk individuals to screen for colorectal cancer. True or false? Answer: true. Rationale: colonoscopy is recommended as a screening tool for colorectal cancer starting at age 50 for individuals at average risk. It should be repeated every 10 years, or more frequently if there are risk factors. 119. Gastric bypass surgery is commonly used to treat patients with severe obesity and can result in significant long-term weight loss. True or false? Answer: true. Rationale: gastric bypass surgery is a bariatric procedure that significantly reduces stomach volume and promotes long-term weight loss in patients with severe obesity. 120. For patients with irritable bowel syndrome, IBS, dietary management, including a low FODMAP diet, is an important aspect of treatment. True or false? Answer: true. Rationale: the low FODMAP diet helps reduce symptoms of IBS by eliminating foods that are poorly absorbed in the small intestine and cause bloating, diarrhea, or constipation. 121. A high-fiber diet is essential for patients with irritable bowel syndrome, IBS, to alleviate constipation. True or false? Answer: true. Rationale: a high-fiber diet helps alleviate constipation in IBS patients by increasing stool bulk and improving bowel regularity. However, it should be tailored to the individual's tolerance. 122. Antacids can neutralize stomach acid and are a suitable treatment for all types of gastric ulcers. True or false? Answer: false. Rationale: while antacids neutralize stomach acid, they are not suitable for all gastric ulcers. In certain cases, acid suppression via proton pump inhibitors or H2 blockers is more effective in promoting healing. 123. It is essential to monitor for signs of infection in patients with a gastrostomy tube, as they are at risk for aspiration pneumonia. True or false? Answer: true. Rationale: patients with a gastrostomy tube are at risk for aspiration pneumonia due to the potential for reflux or improper tube placement, which can introduce pathogens into the lungs. 124. Malnutrition in patients with cirrhosis is often related to impaired protein digestion and absorption. True or false? Answer: true. Rationale: in cirrhosis, liver dysfunction affects protein digestion and absorption, contributing to malnutrition and a negative nitrogen balance, which may lead to muscle wasting. 125. Fiber is contraindicated in patients with an acute episode of diverticulitis. True or false? Answer: true. Rationale: during an acute episode of diverticulitis, a low-fiber diet is recommended to allow the bowel to heal and prevent irritation. Fiber is reintroduced once the acute episode resolves. 126. Pancreatitis often causes severe pain in the upper right quadrant of the abdomen. True or false? Answer: false. Rationale: pancreatitis typically causes severe pain in the upper central abdomen or upper left quadrant, rather than the right. The pain often radiates to the back. 127. Proton pump inhibitors, PPIs, can lead to vitamin B12 deficiency if used long-term. True or false? Answer: true. Rationale: Long-term use of PPIs can decrease stomach acid production, impairing the absorption of vitamin B12 and increasing the risk of deficiency over time. 128. Surgical treatment is often the first-line approach for managing patients with mild Crohn's disease. True or false? Answer: false. Rationale: surgical treatment is not typically the first-line approach for mild Crohn's disease. Medical management with anti-inflammatory drugs and immunosuppressants is preferred initially, with surgery considered for complications or severe disease. 129. A patient with a colostomy should avoid excessive alcohol consumption as it can irritate the stoma and lead to dehydration. True or false? Answer: true. Rationale: alcohol can lead to dehydration and irritation of the stoma in colostomy patients. Moderate consumption is advised to prevent complications. 130. Patients with gastroesophageal reflux disease, GERD, should sleep on their left side to reduce reflux symptoms. True or false? Answer: true. Rationale: sleeping on the left side helps reduce acid reflux in patients with GERD, as this position promotes optimal alignment of the stomach and esophagus, preventing the backflow of acid. 131. The nurse should encourage patients with chronic hepatitis B to receive the hepatitis A vaccine, as they are at greater risk for superinfection. True or false? Answer: true. Rationale: hepatitis B patients are at higher risk for acquiring hepatitis A due to liver dysfunction, so vaccination against hepatitis A is recommended to prevent superinfection. 132. A nurse caring for a patient with a gastric ulcer should encourage large, frequent meals to provide adequate nutrition. True or false? Answer: false. Rationale: small, frequent meals are better tolerated by patients with gastric ulcers, as they reduce stomach acid production and minimize irritation of the ulcer. 133. The nurse should assess for jaundice in patients with cirrhosis, as it indicates liver dysfunction. True or false? Answer: true. Rationale: jaundice, caused by the accumulation of bilirubin, is a common sign of liver dysfunction in patients with cirrhosis, indicating impaired liver function. 134. Bowel resection surgery is commonly indicated in patients with severe ulcerative colitis to remove the affected portions of the colon. True or false? Answer: true. Rationale: severe ulcerative colitis may require bowel resection surgery to remove the colon or portions of the colon that are severely damaged or non-functional. 135. The nurse should encourage patients with chronic constipation to limit their fluid intake to prevent excessive bowel motility. True or false? Answer: false. Rationale: adequate fluid intake is important in managing constipation, as it helps soften stools and promote regular bowel movements. Limiting fluid intake can exacerbate constipation. 136. Lactulose is contraindicated in patients with liver failure as it can worsen fluid retention. True or false? Answer: false. Rationale: lactulose is used in liver failure to treat hepatic encephalopathy by reducing ammonia levels in the blood, not causing fluid retention. However, fluid balance must still be monitored. 137. Patients with gallbladder disease are often advised to avoid fried foods due to their high fat content. True or false? Answer: true. Rationale: fried foods are high in fat, which can exacerbate gallbladder symptoms by stimulating the release of bile, leading to gallbladder pain or discomfort in affected patients. 137. Patients with gallbladder disease are often advised to avoid fried foods due to their high fat content. True or false? Answer: true. Rationale: fried foods are high in fat, which can exacerbate gallbladder symptoms by stimulating the release of bile, leading to gallbladder pain or discomfort in affected patients. 138. Pancreatic cancer is often diagnosed at an advanced stage due to the vague and nonspecific symptoms in the early stages. True or false? Answer: true. Rationale: the symptoms of pancreatic cancer, such as abdominal discomfort and weight loss, are often nonspecific, leading to delayed diagnosis and typically being discovered at an advanced stage. 139. The nurse should instruct patients with a history of gastrointestinal bleeding to avoid taking aspirin or other NSAIDs due to the risk of ulcer formation. True or false? Answer: true. Rationale: Aspirin and NSAIDs increase the risk of gastrointestinal bleeding by irritating the gastric mucosa and promoting ulcer formation, especially in patients with a history of gastrointestinal bleeding. 140. Colorectal cancer is typically detected through routine screening, such as colonoscopy, in individuals over 50 years old. True or false? Answer: true. Rationale: colonoscopy is recommended as a routine screening tool for colorectal cancer in individuals over 50, as early detection can significantly improve treatment outcomes. 141. A patient with a history of peptic ulcers should avoid caffeine, as it can increase gastric acid secretion and irritate the stomach lining. True or false? Answer: true. Rationale: caffeine stimulates gastric acid production, which can irritate the stomach lining and exacerbate peptic ulcer symptoms, so it is advised to avoid it. 142. The nurse should monitor liver function tests, LFTs, in patients taking statins, as these medications can affect liver function. True or false? Answer: true. Rationale: statins can cause liver enzyme elevation, so monitoring LFTs is essential to detect early signs of liver dysfunction and prevent complications. 143. The primary treatment for gallstones is conservative management with pain medications and dietary changes. True or false? Answer: false. Rationale: the primary treatment for symptomatic gallstones is typically surgery, cholecystectomy, to remove the gallbladder. Conservative management is used for mild cases or asymptomatic gallstones. 144. A nurse should encourage patients with chronic diarrhea to maintain a low-fiber diet to reduce stool frequency. True or false? Answer: true. Rationale: a low-fiber diet helps reduce stool frequency and improves bowel rest in patients with chronic diarrhea by reducing the bulk of stools. 145. Patients with cirrhosis are at risk for hepatic encephalopathy due to elevated ammonia levels. True or false? Answer: true. Rationale: hepatic encephalopathy occurs when the liver is unable to detoxify ammonia, leading to its accumulation in the bloodstream and affecting brain function. 146. In patients with ulcerative colitis, corticosteroids are often used during flare-ups to reduce inflammation. True or false? Answer: true. Rationale: corticosteroids are used to reduce inflammation and manage flare-ups of ulcerative colitis, helping to alleviate symptoms and prevent complications. 147. A patient with hepatitis C should be advised to avoid sharing personal hygiene items, such as razors, to prevent the spread of the virus. True or false? Answer: true. Rationale: hepatitis C is transmitted through blood-to-blood contact, so patients should avoid sharing items like razors to reduce the risk of transmission. 148. The nurse should avoid using heating pads on the abdomen of a patient with acute appendicitis, as it can worsen inflammation. True or false? Answer: true. Rationale: applying heat to the abdomen in patients with appendicitis may increase blood flow and worsen inflammation, potentially leading to rupture. 149. The nurse should assess for bruits in the abdomen of patients with suspected liver disease, as they may indicate portal hypertension. True or false? Answer: true. Rationale: a bruit in the abdomen may suggest portal hypertension, a complication of liver disease where blood flow through the liver is obstructed, often due to cirrhosis. 150. A low-fiber diet is appropriate for a patient with an acute exacerbation of Crohn's disease. True or false? Answer: true. Rationale: during acute exacerbations of Crohn's disease, a low-fiber diet is recommended to reduce bowel irritation and prevent symptoms such as diarrhea and CR. 151. Patients with acute pancreatitis should be encouraged to eat solid foods as soon as their symptoms subside. True or false? Answer: false. Rationale: in acute pancreatitis, patients should be kept NPO, nothing by mouth, until their symptoms resolve, as eating solid foods too early may worsen pancreatic inflammation. 152. Patients with celiac disease can safely consume foods containing gluten if they are properly cooked. True or false? Answer: false. Rationale: gluten must be completely avoided by individuals with celiac disease, as even small amounts of gluten can cause severe damage to the intestinal lining and trigger symptoms. 153. The nurse should encourage adequate fluid intake in patients with diarrhea to prevent dehydration. True or false? Answer: true. Rationale: diarrhea leads to fluid loss, increasing the risk of dehydration. Ensuring adequate fluid intake is essential to replace lost fluids and maintain hydration. 154. Lactose intolerance can cause bloating and diarrhea after the ingestion of dairy products. True or false? Answer: true. Rationale: lactose intolerance occurs when the body lacks sufficient lactase to digest lactose, causing bloating, gas, and diarrhea after consuming dairy products. 155. Chronic alcohol consumption is a major risk factor for the development of cirrhosis. True or false? Answer: true. Rationale: chronic alcohol use can lead to liver damage, inflammation, and scarring, eventually resulting in cirrhosis, a serious liver disease. 156. A nurse caring for a patient with a stoma should teach the patient to avoid excessive physical activity to prevent complications. True or false? Answer: false. Rationale: while certain precautions are needed, patients with a stoma can engage in most physical activities. Physical activity helps improve overall health and prevents complications like constipation. 157. Gastrointestinal bleeding is a common complication of peptic ulcers, particularly when left untreated. True or false? Answer: true. Rationale: peptic ulcers can cause gastrointestinal bleeding due to the erosion of the stomach or duodenal lining. Untreated ulcers can lead to significant blood loss and require urgent treatment. 158. In patients with irritable bowel syndrome, IBS, a low FODMAP diet may help reduce symptoms. True or false? Answer: true. Rationale: the low FODMAP diet restricts certain carbohydrates that can irritate the gut in IBS patients, helping to alleviate symptoms such as bloating, gas, and diarrhea. 159. For patients with diverticulitis, high-fiber diets are recommended during acute flare-ups to help the colon heal. True or false? Answer: false. Rationale: during acute flare-ups of diverticulitis, a low-fiber diet is recommended to reduce bowel irritation and promote healing. A high-fiber diet is resumed once the acute symptoms resolve. 160. Total parenteral nutrition, TPN, provides essential nutrients directly into the bloodstream for patients who cannot tolerate oral or enteral feeding. True or false? Answer: true. Rationale: TPN delivers a balanced mixture of nutrients, including proteins, fats, carbohydrates, vitamins, and minerals, directly into the bloodstream for patients who are unable to eat or absorb nutrients. 161. A nurse should encourage patients with ulcerative colitis to drink caffeinated beverages to help alleviate abdominal cramps. True or false? Answer: false. Rationale: caffeine can irritate the gastrointestinal tract, worsening symptoms of ulcerative colitis, such as abdominal cramping and diarrhea. Non-caffeinated fluids are recommended. 162. Hepatitis A is transmitted primarily through contaminated food and water. True or false? Answer: true. Rationale: hepatitis A is an enteric virus that is primarily spread through the fecal-oral route, typically by consuming contaminated food or water. 163. Prolonged use of proton pump inhibitors, PPIs, can increase the risk of Clostridium difficile, C. difficile, infection in hospitalized patients. True or false? Answer: true. Rationale: long-term PPI use can alter the stomach's acid environment, reducing the natural defense against infections like C. difficile, which thrives in a less acidic environment. 164. The nurse should monitor the serum potassium level in patients receiving a diuretic for ascites related to cirrhosis, as it can cause hypokalemia. True or false? Answer: true. Rationale: diuretics used to manage ascites can lead to potassium loss, putting the patient at risk for hypokalemia. Monitoring potassium levels is essential to prevent complications. 165. In patients with non-alcoholic fatty liver disease, NEFLD, weight loss through a healthy diet and exercise can improve liver function. True or false? Answer: true. Rationale: weight loss through a balanced diet and regular exercise can help reduce liver fat, improve insulin sensitivity, and prevent further liver damage in patients with NAFLD. 166. Colonoscopy is the only method used for screening colorectal cancer in patients over 50. True or false? Answer: false. Rationale: while colonoscopy is an important screening method, other methods like fecal occult blood tests, FOBT, and sigmoidoscopy can also be used for colorectal cancer screening. 167. Patients with acute hepatitis should avoid alcohol consumption to prevent further liver damage. True or false? Answer: true. Rationale: alcohol is toxic to the liver and can worsen liver injury in patients with acute hepatitis, so it should be strictly avoided. 168. In patients with Crohn's disease, smoking can worsen the disease and lead to flare-ups. True or false? Answer: true. Rationale: smoking is a known risk factor for worsening Crohn's disease by increasing inflammation and promoting flare-ups. Patients with Crohn's disease should be advised to quit smoking. 169. A patient with cirrhosis should avoid excessive salt intake to prevent fluid retention and complications like ascites. True or false? Answer: true. Rationale: excessive salt intake can exacerbate fluid retention in cirrhosis patients, leading to complications like ascites and edema. A low-sodium diet is recommended. 170. A patient with a colostomy should be instructed to avoid foods that can cause excessive gas, such as beans and cabbage. True or false? Answer: true. Rationale: foods like beans and cabbage can cause excessive gas production, leading to discomfort and odor in patients with a colostomy. Avoiding these foods can help manage symptoms. 171. Patients with irritable bowel syndrome, IBS, should eat large meals to avoid bloating and indigestion. True or false? Answer: false. Rationale: large meals can worsen IBS symptoms, leading to bloating and indigestion. Smaller, more frequent meals are better tolerated by individuals with IBS. 172. The nurse should assess for signs of vitamin K deficiency in patients with liver disease, as the liver is responsible for producing clotting factors. True or false? Answer: true. Rationale: the liver produces clotting factors, and liver disease can impair this process, increasing the risk of vitamin K deficiency and bleeding. 173. A diet high in red meat and processed foods is a risk factor for the development of colorectal cancer. True or false? Answer: true. Rationale: a diet high in red meat and processed foods has been linked to an increased risk of colorectal cancer due to the presence of carcinogenic compounds in these foods. 174. The nurse should encourage a high-protein diet for patients recovering from bariatric surgery to promote wound healing and muscle repair. True or false? Answer: true. Rationale: a high-protein diet is important for patients recovering from bariatric surgery, as it aids in wound healing, muscle repair, and overall recovery. 175. In patients with chronic liver disease, the nurse should monitor for signs of hypoglycemia due to impaired glycogen storage. True or false? Answer: true. Rationale: chronic liver disease can impair glycogen storage and glucose metabolism, increasing the risk of hypoglycemia in affected patients, especially during fasting or between meals. 176. The nurse should teach patients with gastrointestinal reflux disease, GERD, to avoid eating large meals before bedtime to prevent nighttime reflux. True or false? Answer: true. Rationale: eating large meals before bedtime can increase the likelihood of gastric reflux and nighttime GERD symptoms, so it is advised to eat smaller meals and avoid eating close to bedtime. 177. Colon cancer is most commonly diagnosed in individuals younger than 40 years old. True or false? Answer: false. Rationale: colon cancer is more commonly diagnosed in individuals over 50 years old, though younger individuals can develop the disease, particularly if they have risk factors like a family history. 178. Fiber supplements like psyllium can be used to manage constipation in patients with diverticulosis. True or false? Answer: true. Rationale: fiber supplements such as psyllium can help manage constipation in patients with diverticulosis by adding bulk to the stool and promoting regular bowel movements. 179. Antidiarrheal medications are recommended for all patients with acute diarrhea, regardless of the cause. True or false? Answer: false. Rationale: antidiarrheal medications are not recommended for all patients with acute diarrhea, especially if the cause is infectious, as they can delay the elimination of pathogens from the gastrointestinal tract. 180. Patients with pancreatitis should be encouraged to consume a high-fat diet to aid in digestion. True or false? Answer: false. Rationale: a low-fat diet is recommended for patients with pancreatitis to prevent stimulating pancreatic secretions, which can worsen inflammation and symptoms. 181. A patient with a gastric ulcer should avoid taking non-steroidal anti-inflammatory drugs, NSAIDs, due to the risk of worsening the ulcer. True or false? Answer: true. Rationale: NSAIDs can increase the risk of gastrointestinal bleeding and ulceration by inhibiting prostaglandin production, which protects the stomach lining. 182. A patient diagnosed with acute hepatitis should be advised to avoid alcohol and certain medications that may further damage the liver. True or false? Answer: true. Rationale: alcohol and certain medications can exacerbate liver injury in patients with acute hepatitis, so avoiding them is critical to preventing further liver damage. 183. In patients with a colostomy, it is important to monitor for signs of dehydration as the colon no longer absorbs water effectively. True or false? Answer: true. Rationale: after colostomy surgery, the colon's ability to absorb water may be reduced, increasing the risk of dehydration. Monitoring fluid balance is essential. 184. Patients with Crohn's disease are at a higher risk of developing colon cancer due to chronic inflammation of the gastrointestinal tract. True or false? Answer: true. Rationale: chronic inflammation in Crohn's disease can increase the risk of developing colorectal cancer, particularly if the disease affects the colon for a prolonged period. 185. Gastroesophageal reflux disease, GERD, is characterized by the reflux of gastric contents into the esophagus, which can lead to symptoms like heartburn. True or false? Answer: true. Rationale: GERD occurs when stomach acid or bile irritates the esophagus, leading to heartburn and other symptoms like regurgitation and chest pain. 186. A high-fiber diet is recommended for patients with diverticulitis during acute episodes. True or false? Answer: false. Rationale: during acute diverticulitis, a low-fiber diet is recommended to reduce irritation and promote healing of the inflamed diverticula. 187. The nurse should encourage early ambulation after abdominal surgery to prevent complications such as deep vein thrombosis, DVT, and constipation. True or false? Answer: true. Rationale: early ambulation helps improve circulation, reduces the risk of DVT, and stimulates bowel motility, which can prevent constipation after abdominal surgery. 188. Pancreatitis can cause elevated serum amylase and lipase levels, which are key diagnostic indicators. True or false? Answer: true. Rationale: elevated levels of amylase and lipase in the blood are commonly associated with pancreatitis and are used as diagnostic markers. 189. A nurse caring for a patient with cirrhosis should encourage frequent meals with a high protein content to aid in liver regeneration. True or false? Answer: false. Rationale: in cirrhosis, excessive protein intake can worsen hepatic encephalopathy due to the accumulation of ammonia. A moderate protein diet is usually recommended. 190. Hepatitis B is primarily transmitted through sexual contact and sharing of contaminated needles. True or false? Answer: true. Rationale: hepatitis B is transmitted through blood, semen, and other bodily fluids, making unprotected sex and needle sharing primary routes of transmission. 191. Antacids are commonly used to treat gastroesophageal reflux disease, GERD, and should be taken after meals for optimal effect. True or false? Answer: true. Rationale: antacids neutralize stomach acid and should be taken after meals to reduce gastric acidity and alleviate symptoms of GERD. 192. Smoking has no impact on the symptoms of inflammatory bowel disease, IBD. True or false? Answer: false. Rationale: smoking can worsen symptoms of IBD, particularly in Crohn's disease, by increasing inflammation and promoting disease flare-ups. 193. A nurse should instruct patients with a history of peptic ulcers to take their prescribed antibiotics as directed to prevent recurrence. True or false? Answer: true. Rationale: antibiotics are used to treat Helicobacter pylori infections, which are a major cause of peptic ulcers. Completing the full course of antibiotics helps prevent recurrence. 194. Chronic constipation can be managed with lifestyle changes, including increasing fiber intake and physical activity. True or false? Answer: true. Rationale: lifestyle modifications like increasing fiber intake, drinking plenty of fluids, and staying physically active can help manage chronic constipation. 195. A nurse caring for a patient with gallstones should encourage high-fat meals to stimulate bowel production and prevent symptoms. True or false? Answer: false. Rationale: high-fat meals can trigger gallbladder contractions, potentially causing pain or complications in patients with gallstones. A low-fat diet is often recommended. 196. Patients with cirrhosis should avoid taking aspirin to reduce the risk of bleeding due to impaired liver function. True or false? Answer: true. Rationale: aspirin can impair platelet function and increase the risk of bleeding, especially in patients with cirrhosis who have compromised clotting ability. 197. Patients with Crohn's disease should avoid high-fat foods to reduce the risk of diarrhea and malabsorption. True or false? Answer: true. Rationale: high-fat foods can exacerbate diarrhea and malabsorption in Crohn's disease patients, so a low-fat diet is typically recommended. 198. A patient with acute pancreatitis should be placed on a clear liquid diet until symptoms improve. True or false? Answer: true. Rationale: in acute pancreatitis, patients are initially kept NPO, nothing by mouth, or given clear liquids to rest the pancreas and prevent exacerbating the condition. 199. A nurse should monitor for signs of dehydration in patients with vomiting and diarrhea, especially in pediatric and elderly populations. True or false? Answer: true. Rationale: vomiting and diarrhea can quickly lead to dehydration, especially in vulnerable populations like children and the elderly. Monitoring hydration status is critical. 200. The nurse should assess for jaundice in patients with liver disease, as it is a common sign of impaired liver function. True or false? Answer: true. Rationale: jaundice, a yellowing of the skin and sclera, is a classic sign of liver dysfunction, particularly in conditions like hepatitis, cirrhosis, and liver failure. 201. A patient with a history of gastrointestinal reflux disease, GERD, should be encouraged to lie down immediately after meals to aid digestion. True or false? Answer: false. Rationale: lying down after meals can increase the risk of acid reflux and worsen GERD symptoms. Patients should be advised to remain upright for at least 30 minutes after eating. 202. In patients with ulcerative colitis, high-fiber diets should be encouraged during flare-ups to promote bowel movement. True or false? Answer: false. Rationale: during flare-ups of ulcerative colitis, a low-residue, low-fiber diet is recommended to reduce irritation of the inflamed colon and prevent worsening of symptoms. 203. A nurse should teach patients with pancreatitis to avoid fatty foods and alcohol to reduce the risk of triggering symptoms. True or false? Answer: true. Rationale: fatty foods and alcohol can exacerbate pancreatitis by stimulating the pancreas to release digestive enzymes, potentially worsening inflammation and pain. 204. Vitamin B12 deficiency is common in patients with pernicious anemia due to impaired absorption in the small intestine. True or false? Answer: true. Rationale: pernicious anemia is caused by a deficiency in intrinsic factor, which is needed for vitamin B12 absorption in the small intestine. This can lead to B12 deficiency and associated symptoms. 205. Gallbladder disease can be treated effectively with antibiotics alone. True or false? Answer: false. Rationale: gallbladder disease, particularly cholecystitis, is often treated with surgery, cholecystectomy, in addition to antibiotics if infection is present. 206. Patients with liver cirrhosis may develop ascites, a condition where fluid accumulates in the abdominal cavity. True or false? Answer: true. Rationale: ascites is a common complication of cirrhosis caused by portal hypertension and decreased liver function, leading to fluid accumulation in the abdomen. 207. A high-fiber diet is effective in managing the symptoms of irritable bowel syndrome, IBS, and should be incorporated into the treatment plan. True or false? Answer: true. Rationale: a high-fiber diet can help manage IBS symptoms by improving bowel regularity, especially in patients with constipation-predominant IBS. However, some IBS patients may require a low FODMAP diet instead. 208. Non-alcoholic fatty liver disease, NEFLD, is often associated with obesity, type 2 diabetes, and metabolic syndrome. True or false? Answer: true. Rationale: NEFLD is strongly associated with obesity, insulin resistance, and metabolic syndrome, all of which contribute to the development of liver fat accumulation. 209. A nurse should monitor for hypokalemia in patients who are receiving treatment with loop diuretics for ascites. True or false? Answer: true. Rationale: loop diuretics can cause potassium loss, leading to hypokalemia. Monitoring potassium levels is essential to prevent complications such as arrhythmias. 210. In patients with esophageal varices, the nurse should encourage the use of anticoagulants to prevent clot formation. True or false? Answer: false. Rationale: anticoagulants are contraindicated in patients with esophageal varices as they increase the risk of bleeding from the varices. 211. The nurse should teach patients with diverticulosis to avoid eating foods that could irritate the colon, such as seeds and nuts. True or false? Answer: false. Rationale: there is no evidence to support avoiding seeds and nuts in diverticulosis. However, a high-fiber diet is typically recommended to prevent complications like diverticulitis. 212. Antibiotics are used to treat gastrointestinal infections caused by viral pathogens like rotavirus. True or false? Answer: false. Rationale: viral infections like rotavirus are not treated with antibiotics. Treatment focuses on supportive care, such as rehydration and symptom management. 213. A nurse should avoid administering opioid medications to patients with acute pancreatitis due to the risk of sphincter of Oddi spasm. True or false? Answer: true. Rationale: opioid medications can cause spasm of the sphincter of Oddi, which may worsen pain and lead to further complications in patients with pancreatitis. 214. Patients with celiac disease should avoid gluten-containing foods to prevent an immune response that damages the small intestine. True or false? Answer: true. Rationale: gluten triggers an autoimmune response in individuals with celiac disease, leading to inflammation and damage to the small intestine, which can be prevented by a strict gluten-free diet. 215. The nurse should encourage patients with chronic liver disease to increase their fluid intake to help the liver function more effectively. True or false? Answer: true. Rationale: adequate hydration helps support liver function and prevents complications such as ascites and kidney dysfunction in patients with chronic liver disease. 216. Proton pump inhibitors, PPIs, are effective in managing Helicobacter pylori-related peptic ulcers and should be used in combination with antibiotics. True or false? Answer: true. Rationale: PPIs reduce stomach acid production, creating an environment conducive to healing ulcers and enhancing the effectiveness of antibiotics in treating H. pylori infection. 217. Patients with acute liver failure should avoid consuming any medications unless prescribed by their healthcare provider. True or false? Answer: true. Rationale: in acute liver failure, the liver's ability to metabolize medications is impaired, increasing the risk of toxicity. Medications should only be taken under medical supervision. 218. Patients with a history of peptic ulcers should avoid spicy foods to prevent irritation of the gastric mucosa. True or false? Answer: true. Rationale: spicy foods can irritate the gastric mucosa and worsen the symptoms of peptic ulcers. Avoiding such foods is recommended for symptom relief. 219. A high-sodium diet is beneficial for patients with cirrhosis to help prevent ascites and fluid retention. True or false? Answer: false. Rationale: a low-sodium diet is recommended for patients with cirrhosis to reduce the risk of fluid retention and ascites. 220. Patients with gallbladder disease should be taught to avoid large meals and eat smaller, more frequent meals to reduce stress on the gallbladder. True or false? Answer: true. Rationale: smaller, more frequent meals prevent large gallbladder contractions, which can exacerbate symptoms of gallbladder disease. 221. In patients with Crohn's disease, corticosteroids may be used to reduce inflammation during flare-ups. True or false? Answer: true. Rationale: corticosteroids are commonly used to reduce inflammation during flare-ups of Crohn's disease. 222. A low-sodium diet is recommended for patients with acute pancreatitis to prevent complications. True or false? Answer: false. Rationale: a low-sodium diet is generally not required for patients with acute pancreatitis, but fluid and electrolyte balance should be monitored. 223. In patients with diverticular disease, it is important to avoid consuming high-fiber foods during an acute flare-up of diverticulitis. True or false? Answer: true. Rationale: a low-fiber diet is recommended during acute diverticulitis to minimize irritation and promote healing of inflamed diverticula. 224. A patient with gallstones may experience pain in the right upper quadrant of the abdomen, especially after consuming fatty foods. True or false? Answer: true. Rationale: gallstones can block bile flow, causing pain in the right upper quadrant, particularly after consuming fatty meals. 225. A patient with peptic ulcers should avoid taking over-the-counter pain relievers like ibuprofen, as they can worsen the ulcer. True or false? Answer: true. Rationale: nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, can irritate the stomach lining and exacerbate peptic ulcers. 226. Patients with irritable bowel syndrome, IBS, should be encouraged to follow a high-fiber diet to promote regular bowel movements. True or false? Answer: true. Rationale: a high-fiber diet can help alleviate constipation in IBS patients, but individual dietary recommendations may vary. 227. Hepatitis C is primarily transmitted through blood-to-blood contact, such as sharing needles or receiving contaminated blood products. True or false? Answer: true. Rationale: hepatitis C is most commonly transmitted through blood-to-blood contact, such as needle sharing or transfusion with contaminated blood. 228. A nurse should instruct a patient with chronic pancreatitis to avoid alcohol consumption to reduce the risk of exacerbating symptoms. True or false? Answer: true. Rationale: alcohol is a known trigger for pancreatitis and should be avoided to prevent exacerbations. 229. Colorectal cancer is more common in patients with a family history of the disease, especially if family members were diagnosed at a younger age. True or false? Answer: true. Rationale: family history, especially early-onset colorectal cancer, increases the risk of developing the disease. 230. A patient with ascites should be encouraged to increase their fluid intake to prevent dehydration. True or false? Answer: false. Rationale: in patients with ascites, excess fluid retention is a concern. Fluid intake should be carefully monitored and may need to be restricted. 231. A nurse caring for a patient with cirrhosis should monitor for signs of encephalopathy, including changes in mental status and confusion. True or false? Answer: true. Rationale: hepatic encephalopathy is a common complication of cirrhosis, and early signs include confusion, altered mental status, and disorientation. 232. Lactose intolerance is caused by a deficiency of the enzyme lactase, leading to difficulty digesting lactose in dairy products. True or false? Answer: true. Rationale: lactose intolerance occurs due to insufficient lactase enzyme activity, making it difficult for individuals to digest lactose found in dairy products. 233. The nurse should instruct patients with acute diarrhea to consume clear fluids to maintain hydration and avoid dehydration. True or false? Answer: true. Rationale: Clear fluids help prevent dehydration and electrolyte imbalances during episodes of acute diarrhea. 234. A high-protein diet is recommended for patients with cirrhosis to support liver regeneration. True or false? Answer: false. Rationale: excessive protein intake may worsen hepatic encephalopathy in cirrhosis patients due to the accumulation of ammonia. A moderate protein diet is recommended. 235. In patients with irritable bowel syndrome, IBS, stress management techniques such as relaxation and deep breathing can help alleviate symptoms. True or false? Answer: true. Rationale: stress is a common trigger for IBS symptoms, and stress management techniques can help improve symptom control. 236. A nurse should encourage patients with gastrointestinal reflux disease, GERD, to avoid reclining or lying down immediately after meals. True or false? Answer: true. Rationale: lying down after meals can increase the risk of acid reflux, exacerbating GERD symptoms. Patients should remain upright for at least 30 minutes after eating. 237. A patient with chronic liver disease should be instructed to avoid taking vitamin A supplements due to the risk of toxicity. True or false? Answer: true. Rationale: in patients with liver disease, excessive vitamin A can accumulate and lead to toxicity, as the liver is responsible for its metabolism. 238. Gastrointestinal bleeding can present with symptoms such as black, tarry stools, which indicate the presence of digested blood. True or false? Answer: true. Rationale: black, tarry stools, known as melena, indicate the presence of digested blood, often from an upper gastrointestinal source. 239. A nurse caring for a patient with a colostomy should assess for signs of infection around the stoma, such as redness, swelling, or drainage. True or false? Answer: true. Rationale: infection at the stoma site is a common complication, and early signs such as redness, swelling, and drainage should be promptly addressed. 240. In patients with celiac disease, it is important to avoid gluten-containing foods to prevent damage to the small intestine and promote healing. True or false? Answer: true. Rationale: gluten triggers an autoimmune response in celiac disease, leading to inflammation and damage to the small intestine. A strict gluten-free diet is essential for managing the condition. 241. The nurse should teach patients with a history of diverticulitis to avoid eating popcorn, seeds, and nuts to prevent further irritation of the colon. True or false? Answer: false. Rationale: recent evidence suggests that seeds, nuts, and popcorn do not increase the risk of diverticulitis flare-ups, and a high-fiber diet is often recommended. 242. A nurse should encourage patients with an ileostomy to consume high-fiber foods to promote regular bowel movements. True or false? Answer: false. Rationale: patients with ileostomies are advised to avoid high-fiber foods, as they can cause blockages or other complications in the ileostomy. 243. In patients with hepatitis B, antiviral medications may be used to reduce viral replication and prevent liver damage. True or false? Answer: true. Rationale: antiviral medications are often used to manage hepatitis B by reducing viral load and preventing liver damage. 244. A nurse should monitor the serum ammonia levels in patients with cirrhosis to assess for hepatic encephalopathy. True or false? Answer: true. Rationale: elevated serum ammonia levels are a key indicator of hepatic encephalopathy, a complication of cirrhosis. 245. A nurse caring for a patient with a history of chronic constipation should recommend the use of stimulant laxatives to promote bowel movements. True or false? Answer: false. Rationale: stimulant laxatives should be used cautiously and for short periods, as they can lead to dependency. Fiber and fluid intake are typically recommended for chronic constipation. 246. Diarrhea caused by Clostridium difficile, C. diff. Infection should be treated with metronidazole or vancomycin, depending on the severity. True or false? Answer: true. Rationale: metronidazole or vancomycin are the first-line treatments for C. diff infection, depending on the severity of symptoms. 247. A nurse should educate patients with gallbladder disease to eat large, heavy meals to help stimulate bowel production and digestion. True or false? Answer: false. Rationale: large, fatty meals can trigger gallbladder contractions and worsen symptoms in patients with gallbladder disease. Smaller, low-fat meals are recommended. 248. A patient with a history of ulcerative colitis should be encouraged to consume a high-protein diet to support healing during flare-ups. True or false? Answer: true. Rationale: protein is important for tissue repair and immune function during flare-ups of ulcerative colitis. 249. A nurse should monitor for signs of malnutrition in patients with chronic liver disease due to impaired nutrient absorption and metabolism. True or false? Answer: true. Rationale: chronic liver disease can impair nutrient metabolism and absorption, putting patients at risk for malnutrition. Monitoring nutritional status is essential. 250. In patients with a history of gastric ulcers, it is important to avoid consuming acidic foods, such as citrus and tomatoes, which may irritate the stomach lining. True or false? Answer: true. Rationale: acidic foods can irritate the stomach lining and worsen the symptoms of gastric ulcers, so they should